Hello, Vivian Pugh from the Health Forum. One of the things I have to say is that Southern Health have been doing a consultation programme, and I've been on a panel, and we've been looking at fragility. And I find that there are 7 different fragility indices, and so they decided, yes, we would get it down to 1. But how are you going to put all these brilliant ideas, and I really do support what you're trying to do. I support the way that other parts of the health service can work together. We had in my group, we had ambulance driver, we had a community mental health nurse, we had every resource, and GPs as well. And some of the people there were saying, I didn't know that this went on with what you did. And I've got this horrible feeling that there's all these fantastic ideas which are floating around and nobody's actually grabbing hold of one of them and saying to the general public, saying to the 40 groups which are represented at the forum, this is actually, in real terms, how it's going to work. And when you phone the surgery, instead of a doctor coming out to do your home visit, you'll get a band 7 nurse. And people will understand that because they've been told you are not telling the people who are going to use these services except through people like Raymond and myself who sit and get distracted to absolute abysmal lengths listening to you going on. It's great, but how are you going to tell the people about it, please, in a way they understand? That's you, Richard.
So I think you have put your finger on what is holding back at the moment the implementation of a clear, if I call it a way of working. So we've spent 2-3 years across the NHS experimenting and innovating about how we make changes with local people about what the right ideas may well be. And that's been really powerful. It's brought clinicians and some service users together to say this is the way I like it done. But actually the risk is it's left me and others in leadership roles with a plethora of different ways of doing things which actually run the risk of creating more confusion for service users and more complexity and lots of different ways of accessing care rather than clear, simple, understood ways of working. So what we're not going to do is say stop innovating, stop coming up with great ideas, because that's the lifeblood of how care is changing. But what we are saying to local systems, so Portsmouth and South East Hampshire, is just be clear. Don't try and do everything overnight, but let's be clear about the 2 or 3 things that we're going to be changing in 2017-18, and let's allow us then to communicate consistently with the local community and local people. And to example, it might be that for everyone with a respiratory disease, we are going to be encouraging them, if they have computers or smartphones, that they would want to manage their respiratory condition through a new nationally conceived app called My COPD, which allows them to watch videos of inhaler technique, do their pulmonary rehabilitation in their home setting, upload their readings and alerts to general practitioners. Now, in and of itself, it's got hugely high levels of satisfaction levels nationally. It reduces the number of times people feel the need to go and see GPs by 50%, and it reduces the number of crisis-based admissions to secondary care by about 1/3. That's the evidence base. But we can't do that in one practice and let that happen in one practice and do something very different in the next. And then over in Fareham we'll do something very different to that in Gosport. So the simple answer is continue to innovate, but for 17-18 and 18-19, these are the 2 years of delivery and simple scaled implementation. And that's my challenge to David, to Alex, to Sarah, to Julia, to Andy and the clinical leadership community is tell me what the 2 or 3 high impact changes you're going to be making, communicate them well. And I will say they will be absolutely in there as a long-term condition management, be it respiratory disease, diabetes, heart disease, dementia. Those are the areas that people are crying out for support, simplicity, consistency. And that's what my expectation is, as an operating plan for next year, the CCG are going to say, here are the 3 things we're going to do very simply and consistently. And when it's embedded and done well in partnership with the voluntary sector, we then move on to the next 2 or 3 things. And I think that's the tactic, because of those of you who work in commerce and large industry will say that actually it's very difficult for organisations to deliver wide-scale transformation whilst maintaining control and delivery on the board. So keep it simple, keep it stable, but make sure you follow through on your commitment to delivery. And that's not a fair and gospel challenge, that's a consistent challenge that the NHS has, which is on a transformation journey, you need to know what your priorities are and how you're going to implement them. So I would agree, and thank you for your comments.
Can dementia please be high up on the list? As a dementia champion, trying to make Stillington traders dementia friendly, I am very concerned that not enough impact is being taken by CCG about the effect of dementia in your practices. I'll shut up.
I think we've got time for one more question.